If I could choose one thing, is to choose the right skincare. pH balanced and non-irritating cleansers are indicated. The optimal frequency is to use the cleanser twice daily. For moisturizers, to choose non-oily, non-comedogenic and light texture moisturizers. And for the sunscreen, of course, non-comedogenic also, FPS at least 30 and also light texture. In acne, the skin barrier is compromised. When you harsh cleansen your skin, you can worsen it. Please, I kindly ask my patients to avoid the TikToker tips like use of astringents, toners and exfoliants, because they can worsen the barrier and make things worse in acne. No, not at all. It's not a fatality, and it's not only a consequence of severe acne. The main risks for acne scarring are extension, time to treatment, duration of acne, familial history, and of course manipulation of lesions. So please take your hands off the lesions. When you touch the lesions, you raise the risk of acne scarrings and spots. Early early effective treatment of acne will mitigate the risk of scarring and the risk of hyperpigmentation spots. There are some kinds of food that are related to the worsen of acne, especially high glycemic index food, high glycemic load, and some carbohydrates that can have a pro-acnegenic effect. So some kinds of food for some people are not recommended or should be taken moderately. Sunscreens are very important to mitigate some risks of the treatment, especially the photosensitivity induced by the treatments, and also to keep the skin healthy, to prevent the acne spots. And if you take in consideration pigmented sunscreens, you also have a camouflage effect that can enhance patients' quality of life. Stress and deprivation of sleep can rise the levels of some hormones that can rise the sebum production in the skin and can lead to worsen in the acne of some patients. Yeah. One of the main changes is the reduction of antibiotic use. Antibiotics are related to resistance and disruption of the microbiome, and these can lead to a worsen in the acne severity. When the use of antibiotics is indeed necessary, we really encourage our patients to associate non-antibiotic schemes or to encourage them to use multi-pathway treatment to mitigate the use and the length of the antibiotic therapy. When using an antibiotic, its duration should be limited to mitigate the risks. I think they can help us with the comorbidities of acne. So addressing psychological effects, contraception and some hormonal issues, and also monitoring or treating some systemic side effects of the treatment. Multidisciplinarity is interesting in all treatments. It's not different in acne. In acne, we have 5 special actions of dermocosmetics that are anti-inflammatory, antimicrobial, keratolytic, reducing oily skin, protecting skin barrier. These 5 properties may be used in the dermocosmetics to help patients or as monotherapy for light cases, for mild acne, or associated with a medical treatment to enhance the quality of the treatment, or just to make the patient more tolerant to the treatment. So dermocosmetics are really an important part of the treatment.
Actually, all acne patients have some stress because acne is mainly on visible areas. It means face. Of course, it is also on the back, but still face predominates. And what's more, we have the vulnerable age, it means teenagers. They think, oh, grown up, it's okay. But still now, after 25, when the acne predominates, it's already called adult acne. So we have a never-ending story, starting from adolescence and actually going to the adult acne, which actually has different, shall I say, approach as regards skin, and different series of dermocosmetics are required to deal with. Acne patients suffer a lot of stress. In one of the studies, it was estimated that anxiety actually is encountered in almost 68% of acne patients, whereas depression in about 25%. What is more, a lot of patients have suicidal thoughts and even attempts, because acne in the society or by the lay people is still regarded not a disease, which is not true, and the people really in this vulnerable age, it means teenagers, really suffer. Acne has enormous amount of burden on quality of life. Quality of life is regarded by WHO, World Health Organization, as an ability to live productive and enjoyable life. And in everyday practice, we as physicians should use quality of life questionnaires for our patients. The most popular one, it's DLQI, Dermatology Life Quality Index by Professor Finlay, elaborated and Dr. Khan. It has 10 questions, it's very quick, and actually it can be filled in the waiting room, and we as physicians have very quickly the answers. Because it's very important to know what the patient feels about the disease. We can see one pimple, second pimple, so-called, it means a papular nodule, but it could be a tremendous problem for the patient. So for adjustment, what treatment we should give, we should know what the patient feels, because otherwise, no success in treatment. Healthcare professionals should, apart from evaluating severity of the disease by looking, palpating, so it means hard competencies, professional stuff, also ask as regards quality of life and stigmatizing stuff and actual feelings of hopelessness, because adolescent people suffering from acne suffer a lot of bullying, a lot of withdrawal, a lot of social problems. This is a very vulnerable age. So actually, hard competencies and soft competencies. But as regards hard competencies, drugs of prescription really require about 20% of the patients. We should remember that almost 100% of adolescent population suffers from acne, however of different severity. And 80% of all adolescents have acne that really does not require treatment on prescription, but do require dermotherapeutics, which are available in the pharmacies. Dermotherapeutics are between normal, so-called cosmetics, and drugs on prescriptions are very powerful, and they should be used on an everyday basis, just like brushing the teeth. They are extremely helpful, and they're specially designed series for acne patients, and each patient can get something for himself, herself, and use it on an everyday basis, just like brushing the teeth. As regards dermocosmetics, I would like to add as well that when patients are on the prescription drugs, they also should use dermocosmetics, because prescription drugs, which are very powerful, also lead to dehydration of the skin and imbalance of the epidermal barrier, and specially designed dermocosmetics, which could be got on in the pharmacist, actually restore this balance, which is extremely important for the patients and for everyday life.